are at a historic high for the third year in a row. The report was released Thursday. It says more than 370,000 babies were born premature last year. It's when a baby is born before 37 weeks. The report says some of the key factors fueling these preterm births are related to chronic health conditions, climate change, inadequate prenatal care in some parts of the country, and racial disparities. Dr. Lucky Sekhon is here with more on this maternity care crisis. She's a double board certified OBGYN at the Fertility Center, RMA of New York. Good to have you with us. I just listed some of these contributing factors here, but talk about how they can impact these premature births.
Yes, so there are women with chronic conditions, as you said, like high blood pressure, diabetes, infections, as well as certain behaviors like smoking. We know that these are real risk factors for preterm delivery. But there are also major socioeconomic factors that contribute to lack of access to prenatal care, like being uninsured. Environmental factors, as you said, 40% of Americans are exposed to extreme heat when you think about climate, and 3/4 of Americans that are pregnant are dealing with low quality air in their area.
When we talk about premature births, what is the risk for the mom and the baby?
Yes, so mothers who are dealing with preterm delivery and caring for preemies often are at higher risk of postpartum depression. The babies themselves can have a wide array of risks that they're facing, especially respiratory complications. My brother was actually born at 26 weeks and spent the first 5 years of his life in and out of the hospital. So there can be many problems like vision, auditory, as well as learning disabilities. And this is a drain emotionally and financially, not only on the families, but on the system, because many of these babies are going to spend time in the neonatal ICU.
Prenatal care is especially a problem in southern states where preterm births are higher. What's going on in these areas?
Right. So there are certain challenges unique to these populations, especially people living in rural areas. There's this concept of healthcare deserts, and this has been made worse by changes like abortion bans, because this is leading to a reluctance on the part of OBGYNs for setting up their practice in certain areas where the law is going to infringe on their ability to deliver the full spectrum of reproductive care. There's also a higher proportion of uninsured patients in these areas, and that means that prenatal care often falls to the wayside.
So if you live in one of these areas and there is limited maternity care, what are your options?
Yes. So these are situations where we need community-based programs that facilitate people accessing telehealth and having the infrastructure to do so. Mobile clinics, remote monitoring, so that patients don't have to travel hours and hours to get to their healthcare provider, and that this can help close some of the prenatal care gaps that we see.
Here's something else that was in this report. It found maternal and infant mortality rates are going up. They're even higher among Black and American Indian Alaskan Native communities.
Right.
Why is that?
Well, we know that marginalized groups in society face systemic inequities, and there are social determinants of healthcare, things that people don't always connect to accessing healthcare, like access to transportation, being able to meet your basic needs, housing instability, economic instability. Those are all reasons why people are not prioritizing seeing their doctor, even if they're pregnant.
Policy is important. Are there things we can do to try and turn things around?
Yes, we need more healthcare funding. We need to raise awareness and have these conversations and improve education surrounding the importance of prenatal care. And we really need to find ways to close these healthcare gaps by bolstering these community programs that we were talking about.
All right, this is an incredibly important conversation, Dr. Lucky Sekhon. Good to have you with us. Thanks for joining us this morning. Welcome back.